Good morning, good morning. I'm Dr. Dangleben, and on behalf of Patient Choice in the Chemin, Neuf, Pointe, Michel, this is the Daily Medical Tidbit. Someone asked me about night sweats. I did mention it in my last topic, and I thought it was just a good thing to go over. It's what causes night sweats, right? Night sweats is really just excessive sweating during sleep. Right? Many folks have experienced it. You wake up, your clothes is soaked, your bed is soaked, and it's not a diagnosis, right? It's really a symptom, and the differential diagnosis, meaning the range of possible causes, is long, right? It could be benign, it could be hormonal, it could be related to malignancy, it could be related to anxiety, a lot of different physiologic reasons. And I mentioned the pathological causes, right? Infections, lots of infections, including TB. TB was a classic case of the soaking night sweats, all right? Malignancy, especially lymphoma, and I want to emphasize that because one of the things you see with lymphoma, especially Hodgkin's lymphoma, is what's called the B symptoms, and that is fever, night sweats, and weight loss. All right. Other malignancies is leukemia. Right. And I mentioned endocrine issues. Right. Perimenopausal, menopausal has a lot to do with that also. All right. And if you become very hypoglycemic, where your blood sugar just bottoms out, you will get these symptoms. All right. There's a whole slew of medications that can cause night sweats, especially the antidepressants, right? The SSRIs they call, and a few others. Okay. So just know these things can cause that. All right. If you're taking steroids, especially a relatively high dose, these things can cause night sweats. All right. So when the physician is approaching a patient that comes in and say, "Hey doc, I'm having this, uncontrollable night sweats," we have to look at it and structure a differential, right? Like I said, is it infectious? Is it malignant? Is it endocrine? Is it medication? And other things, is it, there's something called idiopathic, meaning you don't quite understand what it is, right? But you have to go through the differential and rule out the other things that I mentioned, right? So the highest concern with night sweats is malignancy, especially lymphoma, right? And you also want to look for chronic infections. TB is still around, right? It's obviously not prevalent, but it's around. HIV can cause night sweats. Endocarditis, which is an infection on the valves of your heart, right? These things. So the red flags associated with the symptoms, not just night sweat, but if you put it together with, for example, unexplained weight loss, persistent fever and chills, right? Enlarged lymph nodes, right? In your armpits, in your groin, in your neck, right? Do you have a persistent cough? Okay. And what else? Are you fatigued? Do you bruise easily, right? Do you feel like you're pale, especially if you pull down and you look under your eyes, all right? So the workup is important to look and make sure that we get down to the bottom, of it, and hopefully it's benign and it's just something that will go away with time. But the history by the physician, the physical exam, the laboratory workup, all these things are important, all right, to get to the diagnosis. Especially these days with all this, conspiracy theorists in terms of healthcare, and vaccines and things like that. You at risk if you have a significant infection, all right? So to the doctors, I say, order the chest x-ray, order the CAT scans if needed, right? Get the ultrasound of the heart. If you're palpating lymph nodes, get a biopsy, get a lymph node biopsy. These are important, all right? So night sweats are often very benign, right? But you have to look deeper to make sure that there's no serious illness causing your night sweats. I just wanted to put that out there. It's not about people getting paranoid and looking for things, but understanding what these symptoms mean and putting it into context. I'm Dr. Dale Dangleben. Have a great day. Peace.